I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. I have two dear friends and colleagues with me here today. It should be a great time. So I have Dina Pizzurro-Smith and Daleigh Tallent. Welcome to the show.
Thank you.
And I'd like to start off by having you just talk a little bit about how you got into the field and your background. So who would like to go first?
I'll go first.
Great.
So I've been a nurse for over 10 years now and started off in acute care, made my way into long-term care, and then kind of fell into the field. I had a fellow nurse supervisor who was an administrator for some group homes, and she kind of took me for a tour, and I was just so intrigued by the complexity of the population, and really the fact that they were very underserved with nursing. So that was a huge draw to me. I've been in the field for 5 years now. Most of my background is at the provider level, and I've been with IntellectAbility for 2 years.
Excellent. Dina?
I sort of fell into it. I was helping one of the partner departments. I worked with mental health and substance abuse. I was helping the DD side do interviews. And as we were doing them, one of the things we had to do when we got close to maybe offering somebody the job was we would take them through the group homes. We also had ICFs and whatever. It was the first time I had actually stepped into one of these facilities. And when I was looking around, I was looking at all these, just carts full of meds. And of course, DSPs are the ones that are giving the medications, and they didn't have any nurses that were like working in the building. I was like, wait, what? I'm sorry. What happened there? So after spending 12 years in mental health and substance abuse, about 10 years ago, I switched from, now I'm in DD.
Excellent. So what do you do now in your work in the big picture?
Well, as most nurses know, our job number one is we do a lot of education and training. So as the director of client services for IntellectAbility, I actually oversee all the staff that does all the training on the health risk screening tool, which, the end result when you do the tool is trying to not only find the risk that the patient's, susceptible for, but what to do about it.
Yeah. And, training's an important aspect. And I think something that nurses don't always have the opportunity to do. Many times they're providing lots of services, but when you work in this field, you end up doing a lot of training, don't you? Yeah.
Yes. And they don't tell you that in nursing school. I was, you don't think that you're going to be a teacher. I didn't get a degree in teaching or education, but being a nurse, that comes with the territory. So I actually have made my way into, I was an adjunct faculty for a bit, just because it's part of what you do, sharing knowledge and information and, hoping that what you're telling, whether it's, a family, a person that you're actually supporting, just giving them those key pieces of information that can really make a difference.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
So we're talking about training, and tell me about your thoughts related to the training that you received on intellectual and developmental disability healthcare in nursing school.
So it was essentially absent.
Unfortunately, that's a common story.
Yeah. And it is so true that, you really need an exposure to know what's out there. And in nursing school, you just get a little bit, mostly in pediatrics. But what I found in every setting that I've worked in is, people with intellectual and developmental disabilities, they're there. You're going to see and be responsible to care for people with IDD in an acute care setting, in your skilled nursing facilities, in your primary care clinics. So we all need to have that information. And because we want more nurses to come into the field, but if they don't know it exists, like most of us, we're really missing that opportunity to pull those new nurses into the field, because when you're a new nurse, you're very gung-ho, like you're all in, and that energy is really what we need.
That's one of the reasons we're doing this podcast, is to get this information out there and help people to understand that this is it's a job, but it's way more than a job. It's a career that you can have in this field that can really impact the lives of people that you support. Did you have any training in?
I didn't, and it was one of those things where exactly what we talked about, I think the other night, was, you got Down syndrome, and you learn a little bit about that, cerebral palsy, areas like that, but nothing, like we don't hear, what was LGS? No, never heard of that until you started working. I think I was talking to somebody yesterday about this, and just think about this for a second. We have an entire accrediting body for nurses. They do not even remotely consider disability nursing as doing any kind of certificate for any kind of accreditation for it.
Yeah. Fortunately, there is some sort of certification and accreditation through the Developmental Disabilities Nurses Association, which is where we're coming to you from today. Great organization we've talked about on other episodes. So yes, the organization does a lot in terms of training and supporting nurses in this field, providing an opportunity for collaboration and to learn from others, which is something that we all need to do. Sometimes you feel very isolated when you're working in this field, and that's one of the values of being a member of an organization like this. Absolutely. So what are some of the challenges that you might see that people might have in terms of accessing healthcare if you have a disability?
Worked in the field, on the floor, I can tell you one of the biggest things was just finding providers that were willing to actually work with this population. I'll never forget one time somebody had to go to the dentist, and we had tried for weeks to try to find one. Finally got one that was going to take our person, and we get there, and of course they're in those big wheelchairs, and they couldn't get through the door. It's just something as simple as that.
Physical accessibility, the physical environment, and then you said the willingness. Why do you think people or some clinicians are not willing? I've got some thoughts. But
lack of awareness. They're afraid they're going to do something wrong. They're afraid they're not going to be able to treat them appropriately. I think there's a lot of fear, honestly.
I agree. And I think, the lack of training is a big part of that. If you came to see me as a physician, a family physician, to have heart surgery, I would be really uncomfortable and really nervous, and you wouldn't have a good outcome because I wasn't trained to do that, And so, training to me can have a huge impact on opening the doors, literally, the doors large enough, for everyone to have access and to be able to receive healthcare from people that have some competency in this field. And I don't think it's a lack of desire. Right. I don't think it's a lack of concern. It's just, this, in my opinion, needs to be part of training for all healthcare professionals. Any thoughts on that?
I actually have a sad story to share. I worked for a small provider in a rural area in Georgia. So, part of the nurse's role, in my opinion, is to really build relationships with those community healthcare providers because, like us, they didn't receive this IDD-specific training. So it's one thing to have that competence and knowing what to look for because our folks don't present clinically like the general population, but also understanding that although a person is living in a residential home, providers are held to facility regulations. So there's going to be more paperwork involved. There's going to be more follow-up. I'm going to be calling you for changes and orders. And we were actually given a 30-day discharge notice from a primary care clinic. So we get a letter with our people's, their names, their birth dates, and it essentially said, we are not able to meet the needs of these people. You have 30 days, and they can no longer be seen. And that's not an isolated event. That's happening, all across the country, and it's really unfortunate. So I think training not only on those IDD-specific things, but also the expectations. And even in your hospitals, I can't take discharge orders that look like orders you would see at a long-term care facility. Like, I need actual prescriptions to provide to my pharmacy, and the route needs to be correct.
When you talked about training kind of in different aspects, and I think I know what you're talking about when we say, there's training on the clinical component, which is very important, but there's training on the what I would call general disability competency or type training, understanding the different types of supports and services that and how to write orders, for instance, that can be followed in a residential setting, and understanding that there is not a nurse there all of the time, even though you might, we're really just looking and understanding this world in so many different ways, so that you can provide supports and services in a way that works for the person. That's the ideal thing. Yeah. So I like to ask guests to tell me 3 things in 3 minutes. We call it 3 and 3. So you each get a turn, and of course, the one who goes first is probably going to steal some of the things that the other person has. So the person who goes first has the advantage. So I'll let y'all figure that out. But tell me, 3 things that you think would have a positive impact in this field in terms of improving health and wellness and supports and services for people with intellectual and developmental disabilities.
So the first we've kind of touched on, and it's the training for our community healthcare providers, our communities in general. This awareness that
I like that, the communities in general, and being more accepting. And we know I'm sitting here stealing your minutes. You'll have your minutes. But the whole social determinants of health and the community involvement has an impact on a person's health and wellness. So it's more than just training the healthcare providers. Yeah. Sorry to take that.
Oh, you're good. Just continued collaboration with interdisciplinary team members, coming forward and feeling comfortable as a nurse and playing that role of advocate. I think a lot of times that kind of falls into, social work. But as nurses, I put that at the top of our list. So I think being aware of that and your responsibility, and then getting comfortable with those interventions. And that's why conferences like this, networking is so important. Like, a lot of people that we support require durable medical equipment, and establishing that relationship. And how did you do this at your provider agency to make sure that your people got the custom wheelchairs they needed, or that those repairs were done? So learning that advocacy piece and the different ways that you can support that as a nurse.
One of the big things that I focused on when I was still working in the field and hands-on was not inclusion. Because what we have a very big way to go, if nobody wants to deal with that anyway, so we're just going to put it off to the side and forget it. When they started closing down all these state centers and they have to integrate into the community, one of the things that I really focused on was you're not just going to take, John to the mall and you're going to shop while John sits there. No. We're actually going to, include what the things that John likes to do and bring him out into the community and show him how whatever it is that he likes to do, how he can do it there. We have to stop, okay, they're closing these places down. We have to stop as an entire population trying to look at somebody differently when they're not different. They're just like us.
Exactly. Same wants, needs, desires.
Yep.
And that kind of leads into, the person-centered supports and services approach. Sometimes we are a little heavy on what we think what we want to do for the person because it's what we think they need. And we always have to balance that with what is important to that person. I mean, none of us want to live in an environment where we're told what to do, when to do it.
Exactly.
All of our lives. We want choice. We want independence. And that's the same for people with intellectual and developmental disabilities. Again, sorry to steal your minutes.
Yeah. I mean, it goes back to just those simple human things, just because they were having breakfast at 7 a.m., maybe John doesn't want to get up at 7 a.m. to have breakfast, and we do forget that it's beyond a facility. It's a home. It's their home. Treat it with respect because it's theirs. So for me, that was always a big piece, is to make sure that it's about them, what they need, what they want, and balancing it with, how it is we can help them live a longer, happier life. So.
Yep. The 2 and the 4, those 2 important things. Well, those are some great things to think about. Great work that you all have done and are doing and continuing to do it. And I'm really happy and thankful that we're doing it together and the opportunities that we have to collaborate on projects. And I really thank you both for joining me today. And absolutely. So keep on doing what you're doing.
Thank you.